Opioid use disorder in criminal justice settings. Opioid use disorder is something very personal to me, which is why I chose it as my main topic for the final paper. I've experienced much loss from this disorder, whether it be to the criminal justice system or overdose deaths. These circumstances piqued my interest in the subject of addiction. As a psychology major, I have been trying to narrow down the area I would like to focus on within the field. Forensic psychology is something that has always interested me and something that I have learned about in previous courses. For these reasons, I decided to combine these two areas to focus on opioid use disorder in criminal justice settings. My goal in doing research for this paper was to learn how the prison system is currently handling opioid use disorder for inmates, including what treatments they provide. Additionally, I aim to research potential treatments that may be useful in improving the criminal justice system's handling of the disorder. Prior to doing research, my knowledge on opioid use disorder was through family members who have suffered. I understood how dangerous these drugs could be, but did not know much about treatment options or how they would play out in prisons. The main aspect of my literature review is opioid use disorder. All individuals in all of the studies I reviewed suffer or have suffered from opioid use disorder. The subtopic of my paper is the criminal justice system. While all of the studies I reviewed include the criminal justice system as well, there are different aspects of it throughout the studies, such as during incarceration, post-release, and drug courts. Some specifics of what this paper covers regarding opioid use disorder in the criminal justice system is treatment programs and barriers to treatment. The first study I reviewed investigated the prevalence of drug use in prison versus in the general community. The European Questionnaire on Drug Use was used for data, which concluded that the lifetime prevalence of drug use was higher in people living in prison than the general population for every type of drug in every country that was included in the study. The next article discussed reintegration. When reintegrating to the community following a prison stay, there is an elevated risk of continued substance use and overdose. This study investigated the barriers in the transition period which inhibit this drug use. These barriers include challenges surrounding housing, employment, and social relationships, and being unprepared for release. Due to the high rate of opioid users in the criminal justice system and the challenges they face, a study was conducted to assess quality of life among these individuals. In conclusion to this study, researchers found that the more severe an addiction was in an individual would lead to decreased mobility, increased anxiety and depression, and decreased utility, all negatively impacting quality of life. In order to understand how opioid use disorder treatment is currently implemented in jail, I reviewed a study on pregnant women in jail with opioid use disorder. Out of the 371 jails surveyed, the findings were that pregnant women had difficulty accessing treatment in jail, yet they still received higher rates of treatment than non-pregnant persons. Therefore, there is limited access to treatment for all individuals with opioid use disorder in jail. Since the federal regulation for opioid use disorder treatment is medications for opioid use disorders, which most jails are not providing, they are going directly against federal regulations. Since it is established that there are flaws in the system, another article I reviewed investigated which areas of research were lacking on this subject. The researchers of this article reviewed discussions, literature, and consultations with experts. Ultimately, they found certain areas and created a list of the top priority subjects for research. These subjects included treatment dose response, pharmacotherapy, evidence-based practices for co-occurring diseases, trauma-informed approaches, and whether or not treatment should be mandated in this population. Medication for opioid use disorder is the most effective and evidence-based approach for treating opioid use disorder. One study argues that extended-release buprenorphine is the best choice of medication for opioid use disorder for criminal justice settings. The benefits include reduced risk of diversion and reducing the need for once-a-day medications. A majority of the participants in the study either preferred buprenorphine to their prior medication or requested a change to buprenorphine. While the effects of medication for opioid use disorder in jails are positive, another study aimed to address the effects of receiving treatment in jail on individuals who are released. This study found that for individuals who received medication for opioid use disorder while in jail, had an 80% reduction in overdose deaths within 1 month of release from jail. Additionally, all-cause mortality was decreased by 78% for these same individuals. There are many treatments that can be used in addition to medication for opioid use disorder for individuals with opioid use disorder in the criminal justice setting. The Helping End Addictions long-term organization conducted a study to find more strategies. The communities in the study were required to choose a certain number of strategies to try. The number of strategies these communities chose greatly exceeded the requirement. This goes to show how serious this epidemic is and how desperate we are for help. The most chosen strategies in this study were from the category overdose education and naloxone distribution, followed by medications for opioid use disorder. These results show more than one treatment methods may be used in conjunction in order for the greatest chances of recovery. In an effort to find ways to support individuals with opioid use disorder after they are released, a study was conducted on a digital health service. This health service would include teaching adaptive strategies for coping and receiving personalized feedback interventions. The participants in the study were quite receptive to the digital health service. This intervention is highly accessible and supportive with promising results. The benefits to drug courts over incarceration for individuals with opioid use disorder include reducing recidivism by 12%, reducing drug use, improving client-family relationships, and increasing access to financial and social services. A study was done to compare the treatment policies for opioid use disorder in drug courts compared to the actual practices. The study found that substantial progress in policies have been made in recent years. 73% of drug court programs reported they have policies in place for medication for opioid use disorder, including staff training and prescribing physicians for medical decisions. Unfortunately, only 11% of these programs reported that their clients receive medication for opioid use disorder treatment despite having policies in place. This being said, the progress in policies has not led to effective implementation. In conclusion of my research, the most important thing I learned is the necessity of doing research on this topic. The opioid epidemic is clearly prevalent in the criminal justice system. Although progress in this area has been made, there is more work to do. A major issue that needs to be addressed is the lack of access to treatment in facilities. We cannot incarcerate individuals with opioid use disorder and expect them to get better without receiving any help while incarcerated. There are clear benefits of receiving treatment while in the criminal justice system. Not only does treatment benefit individuals while in a facility, but the benefits extend into release. By providing inmates with opioid use disorder treatment, we are setting them up for success long term. Medication for opioid use disorder is the standard policy of treatment for opioid use disorder. Buprenorphine is a superb option to use for persons in the criminal justice system. Supplemental treatment options include overdose education and naloxone distribution, along with digital health services. Some of the improvements that have been made on this topic have been in implementing policies. However, developing these policies has not translated to an increase in treatment. Therefore, more research must be conducted on how to turn these policies into practice. Upon completion of research, my understanding of opioid use disorder in the criminal justice system has completely changed. While I assumed treatment in the criminal justice system was lacking, I did not expect that federal mandates for treatment were not being followed. This leads me to question what exactly the problem is in not following through with expectations. A known problem regarding drug addiction is stigma, which may contribute to this problem. The learning process for this paper taught me more about how learning in the psychology field in general is conducted. Theories and evidence is always changing in the field, which results in many changes in how treatment is implemented. At one point in time, all psychological disorders were heavily stigmatized against, which led to inhumane treatment. While major improvements have been made, the criminal justice system certainly has areas to improve on in treating these individuals humanely. The biggest thing I learned from my research is the importance of learning. While I've always known it is important, I have realized that it is the only way change will occur. Before my research, I did not realize the magnitude of this problem. The more people who are learning about this problem creates more people who can push for change. This importance of learning can be transferred to all subjects that face problems in need of change.